I'm going to talk now about mystical molecule number 2. This one is sex hormone-binding globulin. Often you will see it as SHBG. This molecule is so misunderstood and so misinterpreted. Doctors do not know what to do with this sex hormone-binding globulin. They don't understand where it comes from. They don't know how to treat it. And the same holds true for patients. Well, first of all, this molecule is made in the liver. So anything that has influenced the liver at some way, at some point in time in your life, will probably cause the liver to make more sex hormone-binding globulin. Why is it called sex hormone-binding globulin? It's called because this molecule is a protein, glycoprotein we call it, which is like a sugar molecule combined with a protein molecule, and it binds steroid molecules, and the most important ones that we're interested in are dihydrotestosterone is the most tightly bound, much more than testosterone. Then it's testosterone and even estrogen. When testosterone is bound to sex hormone-binding globulin and you measure total testosterone, you do not know how much free testosterone you have. The amount of free testosterone in the body is about 1.5 to 2.5%. In understanding how testosterone works, it has to move out of sex hormone-binding globulin, become free to be able to enter the cell and do its work. So this hormone controls the milieu of cell-active testosterone. So there are many different conditions which can lead to high levels of sex hormone binding. So I'd like to kind of go through a list of them. The first condition, which has been well established, is hyperthyroidism. If you have Graves' disease, where you have an excess amount of thyroid hormone, or if you take too much thyroid hormone, you can accelerate the amount of sex hormone binding globulin made. However, this condition can be treated by various diseases, by various medicines, I should say, and so that you can move somebody into a normal thyroid state, and then the sex hormone-binding globulin should also compensate for that. The other conditions are if you have an eating disorder and you're not eating enough in general, your sex hormone-binding globulin can go up also. Sometimes I see patients who have high sex hormone-binding globulin. They don't say they've had anorexia or eating disorder, but they may have in their lifetime, and that may have injured the liver and caused the liver to produce more sex hormone-binding globulin. The next condition I'd like to talk about is that if you eat a very low protein diet, you can also elevate sex hormone-binding globulin. Then probably the hidden condition, I should say, is alcoholic cirrhosis. Mostly seen in men, not women. These are men who may have been drinkers at some point in their lives, maybe in their teens or whenever, maybe don't drink at all right now, but their liver did get injured and may have developed cirrhosis, which is scarring of the liver. Now there is one test we have today which has just been developed. It's called ultrasound elastography of the liver to see how elastic it is. If the liver is not elastic, it means something's wrong. It's either got fibrosis, it might have depositions of maybe excess fat, or maybe iron and other conditions, all of which can lead to excess sex hormone-binding globulin. Advanced age, now the question is, why should, I see a lot of older men, obviously young men. These older men come in with a total testosterone like 1,100, yet when you look at their percent of free testosterone, it's very low, and they maybe have a percent that's like 40 or 50, what we call nanograms per DL, and so they have they make a lot of testosterone, but the usable testosterone is not enough. Now, why should an older man have that? Well, my own interpretation is that these men have in their lifetime injured their liver, and it starts to express itself as they get older. Other conditions which can lead to excess sex hormone-binding globulin is excess estradiol. And I'm not talking about like 27 to 30 are 35 picograms per ml, which is more or less normal for most males. I'm talking about some sort of maybe tumor that produces estradiol, which then does stimulate the sex hormone binding globulin. So women on birth control pills will have high sex hormone binding globulins because they're using very potent estrogens. Now cancers are another issue because sometimes cancers themselves will insult the liver, and insulting the liver causes, again, sex hormone binding globulin to go up. So you have to be wary of these patients with sex hormone binding globulin to be elevated to make sure they don't have some sort of underlying cancer. Men who've had, let's say, cancer and had chemotherapy, which injures the liver oftentimes, can also have elevated sex hormone binding globulin. Breast cancer can occur in men. 3 or 4% of men develop breast cancer. I do have a number of men who have a condition called gynecomastia, which is an enlargement of the breast tissue. If you see a patient like this, you should follow them very closely. Make sure that the breast tissue is not getting bigger. If it is getting bigger or there's nodularity, you should get a mammogram. And if there's anything suspicious, I think it's best just to remove it by a good plastic surgeon. I oftentimes have the men with gynecomastia or male boobs go to a plastic surgeon and just remove the tissue because of concern of cancer and the aesthetics and how you look. Men don't like to have what's called male boobs. Now, clomiphene citrate is a drug taken to elevate your testosterone levels and sperm levels. And it does have an estrogenic component which can lead to sex hormone binding globulin elevation and lowered free testosterone, and also even lowered IGF-1, which is a growth hormone product. We've talked about high sex hormone binding globulin. What are the conditions in which you see low sex hormone binding globulin? Obesity actually lowers sex hormone binding globulin, which is interesting. Diabetes, when you see somebody who has a very low sex hormone binding globulin, check them for diabetes, because that's something that has to be ruled out for sure. If you have very high insulin levels for some reason, that can lead to low sex hormone binding globulin. That actually, the sex hormone, what happens with the high insulin, you get low testosterone. All right. Synthetic anabolic steroid use will also lead to low sex hormone binding globulin. So if somebody's taking something like decadurabolin, Winstrol, oxandrolone, you'll find their sex hormone binding globulin to probably drop by 50%. And if you have a very low thyroid, and thyroid is not working well at all, that can lead to low sex hormone binding globulin. Conditions like hyperprolactinemia, which is excess production of prolactin from the pituitary gland, which lowers testosterone, but it raises, or lowers also at the same time, sex hormone binding globulin. So that's a tip-off. If somebody's got hyperprolactinemia, low sex hormone binding globulin, these men must be studied, their pituitaries, to see why there is hyperprolactinemia. We'll talk about that in the next shoot about the mystical molecule number 4. Elevated growth hormone itself produces low sex hormone binding globulin, which is associated with IGF-1 elevation, and that's insulin growth factor 1. Most people using growth hormone or have studied it realize that that's the end product of when you use growth hormone, you make insulin growth factor 1, which produces cell growth. So now the really question gets down to, I have really a lot of men sort of in a tizzy about, I've got this elevated sex hormone binding globulin, my free testosterone is low, what am I going to do about this? Well, I'll tell you, there's really no good medical drug that you could use, but there are several supplements. Probably the best one, there's boron, which you can use about 10 milligrams a day, which seems to lower sex hormone binding globulin, increase free testosterone. Then we have stinging nettle extract, which also will lower sex hormone binding globulin and give you more free testosterone. Thirdly, we have Avena sativa, also known as wild green oat extract, and there is a portion of it, the saponin portion, which can lower sex hormone binding globulin and free up testosterone. So this is all, men are very happy when they use some of these products and they work. I can't say they work for everybody, but my experience with the number of patients who use these products do show higher free testosterone levels. Using vitamin D and magnesium may also help you to lower sex hormone binding globulin and give you more free testosterone. And that's readily available, and it's recommended anyway that men should have at least 5,000 up to 10,000 units of vitamin D daily. Take it with food. And magnesium is also very good for your brain to begin with. And it's good if you take it before you go to bed. You'll sleep better, but also may help you with your sex hormone binding globulin.